what broke the camel's back is that recently, for the past 3 months, our post-home serve nurses, those people who have completed their community service, have not been paid for 3 months. And some of them already have been paid in the past few weeks after we've raised these issues in the media. But we still have others which are still not paid yet. Like in Swan, where they're saying they've got issues with admin not being able to access their building. But those people are still without salaries for the 4th month now, which is unacceptable. And there's conditions of services within the Department of Health in Gauteng, which are not helping with. Issues of safety, shortage of staff, issues that we've ventilated before, and the retrenchment of nurses who have completed their community service nurses course. That is essentially what the Department of Health in Gauteng is doing. They are terminating the services of those nurses who have completed their community service. But those nurses should be employed because we've got a dire shortage of nurses in the province.
Yeah.
And this was evidenced even by the way we had to go and get people on contract when COVID struck. The intake of nurses has been reduced. And as a result, the colleges in Gauteng have only been having an intake of about 200 students per year, which is inadequate to address the current shortage of nurses that I keep highlighting. And in order for us to be able to get enough nurses, we should be taking in about 1,000 nurses at least between the colleges. But at the moment it is not happening. And the reason for that is because we don't have lecturers who are qualified to be able to offer the current qualification. So it's a number of issues that need to be looked at, and it's not a provincial issue, it's a national issue.
It's bad because now if you're expected to get the money that you're supposed to get, and then they give you, let me say, just peanuts, it's going to affect you even at work, because now you can't eat, the family can't eat, you have to travel to work. So that thing is another thing that's a problem. That's why we're here today. Okay. Just to make sure that they understand that we want this thing, we're not begging them.
I mean, we haven't been paid, our policies there's lapsed, we don't have any policies, so we're just walking free-handedly right now. Anything happens in hospital, nobody's going to take care of you. Our children aren't even going to school anymore because we couldn't pay school fees. And they don't understand in the place that we go to. Instead, they were telling us that we should just go to the banks and ask for a letter or something that we can't pay our debit orders for 3 months. They'll pay us when the time is right.
Because they did not give us in 2020 our increase, in 2021 they gave us that lousy one. They are still offering a 2% for this year, comrades. What a shame. What a shame, comrades. Imagine a 2% when petrol just increased by more than 10 rand already. Imagine a 2% when in 3 years you never received the real increase. Imagine a 2% when you are spending more than 20% on the cost of electricity in that period of time.